Good afternoon and welcome to the Gender Equality Forum 2022. Welcome to the audience here in the room and welcome to those following this session online. You have joined the session Living and Working in Europe in an Era of Disruption, Gendered Impacts, Challenges and Opportunities. And this session is organized by Eurofound, the European Foundation for the Improvement of Living and Working Conditions. My name is Barbara Gerstenberger. I'm the head of the Working Life Unit in Eurofound, and I will be moderating this session this afternoon. So, what can you expect? We have organized this 75-minute session in 3 panels. We will first look at the impact of the COVID-19 pandemic on life and work in Europe. And then in a second panel, we will look at the next disruption, the cost of living crisis, the issue of energy poverty as a consequence of the war against Ukraine. So our main interest is in the gendered impact of these crises. The question, do they impact differently on men and women, and why? And then in our third and final intervention, we will try to answer the question, what needs to be done in order to reduce gender inequalities in coping with the effects of these crises and disruptions. So let me introduce our first panel. I'm very happy to have with me here on the stage, it would be very lonely otherwise, my colleague Martina Bisello. Martina is a research manager in the employment unit in Eurofound, and she is an economist by training. Gender gaps are among her key research interests. She has published a number of studies on the issue, which you can find on the website of Eurofound. And I should also mention that Martina is responsible for coordinating the cooperation between Eurofound and the European Institute for Gender Equality, EIGE. And I think this session in the Gender Equality Forum 2022 shows that the cooperation is going quite well and leads to tangible and fruitful results. We will then hear in this session from Anna Kopp. She is joining us, and I'm happy to say not for the first time. She is Director of IT at Microsoft Germany and the Women's Community Lead for Europe, the Middle East and Africa for the organization. She is also the co-chair of the Women at Microsoft board. Anna is a specialist in the new world of work, and she looks at this from a cultural, from a political, and from a practical perspective, and she very strongly advocates flexible working models, and I'm sure we will hear more about that when she takes the floor in a little while. And also in this first panel, we welcome Phil Nee-Hay. She's the General Secretary of the Nurses and Midwives Organization in Ireland, the INMO. Phil is a trained intensive care nurse. She has worked as an ICU nurse in Ireland, her home country, but also in Australia, the UK, and in New York. As a General Secretary of the INMO, she is leading advocacy on national nursing policy in Ireland. And very interesting, I think, for us to note is that in 2019, she led the organization's first strike in 2 decades, winning pay increases and staffing improvements for nurses and midwives. I'm sure we will also come back to that topic, the improvement of working conditions, including pay of nurses, midwives, healthcare workers in general. But before we hear from Anna and Phil on their experience, the experience of their members, of their employees during the pandemic, I would like Martina to kind of set the scene for us. Now, Martina, correct me if I'm wrong, but we could be in a really good place right now when it comes to employment, because if you look at developments a little less than a year ago, at the end of 2021, European labor markets had actually very strongly recovered. We were heading towards pre-crisis levels of employment, and then, of course, a new crisis came with the Russian invasion of Ukraine. But what exactly happened to employment during the pandemic, and were all socio-demographic groups equally impacted?
Thank you, Barbara, and good afternoon to you all. So there's no doubt whatsoever that the pandemic has been extremely disruptive for European labor markets, but as you said, the recovery has been pretty fast. And by the end of 2021, we had employment levels, hours worked, and the share of workers on furlough returning pretty much to pre-pandemic levels. And we are actually now more concerned from a policy perspective about labor shortages than unemployment. And the resilience, the great resilience of the EU labor market has been also strongly related to the very prompt policy response and the scale of the state resources that were implemented to support employment, and notably via short-time working schemes. As you mentioned, now we are facing a new period of uncertainty with multiple shocks creating really a perfect storm. So we need to see to what extent, the resilience of the European labor market will continue. But we also know that the effect of the COVID crisis has been extremely asymmetric across different groups of workers. We know that young people have been tremendously affected in a negative way, notably because of their precarious labor market conditions and because they were working in sectors mainly non-essential, which were then closed during the pandemic. But we also know that the recovery itself has been uneven across both labor market groups, across sectors and occupation. And on the positive side, we know that teleworking possibilities offer really a buffer to employment, but we also know that they tended to be skewed towards more highly paid jobs. Now, from a gender perspective, if we look at the employment impact of the crisis at the aggregate level, especially when we compare it to the previous crisis, the Great Recession, we actually see that the employment effect has been much more even across gender. We know that the previous financial crisis hit very hard manufacturing and construction, two sectors heavily male-dominated. So kind of the immediate impact was mostly felt by men, although we're all aware that then the post-crisis austerity measures hit women as well because of the cuts that were made in public service provision and public sector employment. But at least in the immediate effect, it was very sharply felt by men. And in this case, with the COVID crisis, there were strong initial concerns that this would have been a so-called she-session, meaning a recession where women were mostly hardly hit compared to men. And I think that now that we are in 2022, so we have gathered also more data, and we can see a little bit more kind of the full picture through time throughout the pandemic. We can see actually that in 2020 and 2021, the gender employment gap continued to decrease at a slow pace, a similar slow pace than what it did a decade ago. And by the end of 2021, there were actually more women in employment than men. Actually, 1 million men lost jobs, and there were plus 600,000 women in employment. Now the question is, does this mean that women were not negatively affected by the COVID pandemic? And my answer would be certainly not. The answer is that if we look at aggregate indicators, we can't really grasp all the nuances and really fully understand what the impact of this crisis was. And I think the key here is to look at the different type of workers and women in different type of service jobs, because the employment fallout of the COVID pandemic has really been a story of different type of service jobs. And in my view, it would be very useful from a gender equality perspective to focus on three main group of workers. First of all, we have client-facing service workers. So we're thinking of in-person services, hospitality, leisure, and so on. These, of course, are services that were heavily impacted because of lockdown restriction, because they involve a high degree of social interaction. But these are also highly feminized jobs, and also very low pay. If you think of the HoReCa sector, the hotel, restaurant, and catering sector, 10% of employees earns the minimum wage. So it's really, when you look at the impact, the employment impact of the COVID crisis also across the job wage distribution, that you see that it's women in low-paid jobs that were particularly hit in a very hard way. And the recovery as well for these women is actually much slower. So that's an important point. And actually, the single most affected job in terms of employment losses has been a retail salesperson. This is a large employing job in Europe. 1 out of 20 workers work in this job. And 2/3 of the employment losses were among women. So a particular attention should be devoted to this group of women in low-paid jobs. Then the second group is clearly women working in essential services, frontline workers. They were able to retain their job, and they were expected to continue to perform their job at their usual location. But of course, there were implications in terms of working conditions, job quality, and also well-being, which in the long term could have, of course, repercussion in terms of labor market attachment itself. And here I'm thinking clearly about healthcare workers, healthcare professionals. They were at the front line of the battle against COVID with an extremely disproportionate risk of infection. Now, health professionals are a large employing job and also fast-growing jobs. And in the last 20 years, the share of women employed has actually increased. So there is increasing actually gender segregation. And this is part of a broader trend of increasing gender segregation in the labor market, whereby we see that in the last 20 years, the increase in female participation to the labor market has been primarily concentrated in jobs that were already female-dominated or mainly female-dominated, such as in the healthcare sector, but also among teaching professionals and in public administration. So, there are, as I said, issues related to job quality and working conditions in these jobs already before the pandemic, but the pandemic exacerbated these concerns in a way. And I think we're all familiar with the expression and the phenomenon of workers quietly quitting their job, but actually I think that as a society we should be much more concerned about the wave of nurses but also teachers and childcare workers, which are not quietly quitting their job, but desperately quitting their job because of burnout and being underpaid and undervalued. And I think that apart from the effect of the pandemic, looking forward in the long term, we're in the context of a demographic shift and increasing need for care provision. So the role of these workers, besides their value and their contribution to the society during the pandemic, also in the longer term, should be really much more appreciated. Now, the third category of workers impacted by the pandemic is office-based knowledge workers who had the opportunity to retain their job and perform it from home. And we know that COVID really accelerated the digitalization of workplaces. There's been a surge in the incidence of telework. Before COVID, around 11% of employees only were working from home in 2019, and this doubled to 22% in 2022. So, women, if we look at labor market data, were slightly more likely to work from home, both before the pandemic and during the pandemic. And this has implication not only in terms of work-life balance, because we know that women have to, juggle between work and unwork paid task, but it has also potentially, in terms of labor market attachment and progression, implication in terms of visibility at the workplace and further progression in their work. So, in a nutshell, my key message is that it's not enough to look at aggregate labor market indicators. We really need to look at the experience of women in different type workers to understand better the impact of COVID.
Thank you so much, Martina. Indeed, a very clear message. So if we look at the aggregate level, the labor market story is not a bad one for women, but if we look in more detail at the groups, after all, we see a very asymmetric impact of the pandemic on labor market developments, looking at men and women. So you introduced us to these three groups, the client-facing service workers, the essential workers, and then the office-based knowledge workers, those with the ability to telework. And this is, of course, a group that is the vast majority, I would imagine, of Microsoft's employees. Anna Kopp, if you could tell us a little bit about what happened in Microsoft during the pandemic, and maybe also comment on the question, are there concerns about gender equality issues linked to this move towards remote work? Do we have Anna with us? Yes, we have. Hello, Anna. So good to see you. So good to see you. So maybe start with this question, describing a little bit for us what happened in Microsoft during the pandemic.
Thank you. Yes, so I hope you can hear me well there in the room. Hello, everyone. Kind of the first answer is nothing much happened because we already were so used to working from home. But as the infection progressed and we started getting lockdowns, I mean, it's a big difference to say, hey, I'm working from home on Friday versus really staying home and working there for months and months. And this is a really big balance issue. And of course, office workers is also not all the same, because if I'm a very senior vice president person, of course, I can sit and do my calls from home. I might have a nanny or someone. So, and that's, just the top layer of people. So I would speak about just all the other women that have a normal middle level job at Microsoft. But I also know that because I've been speaking with so many other companies that it's similar in other IT companies too. And the first thing I want to mention is that I saw a very big difference in the countries. So I'm from Sweden originally. I'm calling in from Sweden today, actually. But normally I work out of Germany and work for the German subsidiary. And as a Scandinavian, I see that there's a higher level of equality there already since the 60s and 70s. And how I grew up, that men and women, they shared taking care of the family and the housework and everything. And I remember when I took my German husband and I were met at the company and we went to a big customer in Stockholm together. And he was quite shocked that already at 4:30 in the afternoon, the CEO of this big telco company said, all right, I need you people to leave because I'm picking up the kids. And this was 2004, I think. And I mean, that's 18 years ago already now. So that's how fast and long time has run. And at the time, it was for him, very unusual that a customer and the CEO of a customer, just says, okay, we're ending this meeting, thank you, to pick up the kids, because that's, what he's got the wife for. But Scandinavia is just very 50-50 in comparison. And Germany is not quite there yet. But we had a mirror put up here across all of the European countries and saying which country might have better gender equality, because for the women to prosper and be able to carry the load in the workplace, and then during a pandemic that puts additional load on it, well, you have to share that load. And in some countries that work better than others. So it was interesting to see the ranking in Europe, that the more south you came, that the more struggle it was for the women in the workplace. So that's one of the things I've been seeing. And of course, it's good when you can keep your job, you can carry on your career. You don't really lose 2 years like someone that is possibly where the job disappears, or that has a bit of a plateau there and then moving on. But because of this and because of much of the care work was put on women, of course, there was a lot of burnout and mental health issues there as well in certain countries. And that's what we've been looking at, as for example, if you look at countries that have more kindergartens and more children's care, and you compare that to the burnout rate during the the pandemic, well, then you see a clear correlation there as well. Another thing that we saw at Microsoft was, and it's going to get interesting, but because we learned we can work from anywhere, for any company, how important it is for the companies to care for the loyalty of the employees. Because we can do our job from pretty much anywhere. I don't need to go to the office at all. So, I mean, one of the effects can be that someone said, I work from home, and whichever company just pays me more, I'm just going to quit and go to the next one and just keep doing my job and get paid well. So for companies to keep the employees and keep the women, because of course, we've been working hard for years to have a very good equality, meaning that we want to retain the women in our company, and so does all the others. And they're also still working on increasing women in their companies. So, you know, of course, a lot of people are there, war for talent, and out, the headhunters, you know, are specifically talking to women. So companies need to think more about what additionally am I now in this world post-pandemic giving to retain my employees, to have that loyalty. For example, what can I learn? What certifications can I do? What support do I get? Do I have fun at work? And that's quite hard to do when people are no longer coming into the office every day. But it's important because otherwise I think in Europe we might see continuous small waves of people changing jobs to other companies at a higher pace than before the pandemic.
Thank you so much, Anna. Can I quickly follow up with one other question, confronting you a little bit with the results, the latest results of the European Working Conditions Survey, the wave that we did in 2021, where we saw among those working from home that on the one hand, yes, better work-life balance, more flexibility, more autonomy, but also longer hours, high work intensity, a very high level of presenteeism, working while sick. Is there anything in Microsoft that you do, well, first question, would you experience the same situation? And what does the company do to address these negative impacts?
One kind of cool thing that we did, we have a lot of researchers in the US, and they decided to stick brain scan sensors on employees who volunteered, of course. You don't just go and do that and say, hey, we want to check your stress level during the day. So they had people that were on end-to-end calls, no break, just ending a call and then not even time for a drink or the restroom and then going to the next one, versus people that took breaks. And we got those statistics. And it was very clear to see on brain scans that people that don't take breaks get much more stressed. And in the end, at the end of the day, you just didn't deliver as much as someone that made sure that they cared for themselves. So this is one of the things that most companies now implemented, in that the technology, for example, in a calendar, that you no longer schedule hour after hour, but you try to do an hour call, 45 or 50 minutes, and half-hour calls, 20, 25 minutes.
Anna, you're back. You're not off the hook yet. We'll come back to you at the very end. But right now, I want to move to Phil Nihey. Phil, we're now turning to a group of workers which, of course, experienced the pandemic in a very different way from how Anna just described the situation in Microsoft and for the employees of Microsoft. So frontline workers in healthcare, nurses, midwives. Maybe, again, as a first question, can you recall for us the challenges they faced during the pandemic as being the ones at the front line?
Thank you very much, and lovely to be here and to be able to participate. Yes, I think thinking back to March 2020, the big issues that we faced was, first and foremost, to have adequate protections in place for workers, predominantly women. 4 out of every 5 healthcare workers in Ireland are female, the exception being medical and dental consultants. In our ranks, nurses and midwives, 91% of all the workforce are female. And obviously they have responsibilities outside of their work. So the big concerns they had were the unknown nature of the infection. We had a lot of debate about whether it was airborne or whether it was transmitted by droplet. So at the very early stages, we were not satisfied that the masks that were being provided were sufficient to protect. Unfortunately, we were proven right, and all of the infection rates amongst healthcare workers, the highest were amongst two groups of staff, healthcare assistants and nurses, and the healthcare assistant works to the nurse. So those closest to the patient had the highest infection. 34% at one point of all infections that were recorded were amongst those two categories. It's extremely high risk. The mask situation took along a lot of lobbying and a lot of, I suppose, argument and public lobbying by ourselves and other trade unions. So the first concern was, are we protected when we're going into these environments that we really don't know what's facing us? A lot of our members felt that on returning home, the advice they got in respect of how to decontaminate, essentially, was really down to ourselves as their trade union and other infection control interested parties. But there was no official, for example, there was no showering rooms in many of the hospitals. There were no change of clothes places, because some of the hospitals are very old and didn't have space. So they felt that they were asked to do a very, very high risk, play a very high risk role, wear inadequate PPE, and were exposed to a higher level to the infection. That improved once vaccines came on board, and obviously we lobbied that they should be vaccinated as one of the first groups, and they were. But having said that, there was an awful lot of mistakes made in respect of PPE, even when information was known, when the WHO had a lot of good advice. We were still slow to change from ordinary surgical masks to FFP2, which gave a greater degree of protection. The social aspect for the women workers where childcare was a big issue. Schools were closed in Ireland very early on, and there were a lot of our essential workers are married to essential workers or co-parenting with essential workers, and a large proportion are also lone parents. The government did introduce in about April of the end of April 2020 a facility to allow essential workers that their partners could work from home, and the exception to this was those who worked in the health service. So it actually made no difference to healthcare frontline workers. And our Taoiseach at the time made this comment and said, look, we know this is not going to assist those essential workers married to essential workers or co-parenting, or indeed lone parents who work in the health service. So I remember representing nurses who, for example, were told that they had to complete their shift, they had to come on duty, and if they didn't, that they would be disciplined. Now, this was when they had nobody to look after their children at home because schools were closed, childcare facilities were closed. There was one particular lady who rang us one morning quite despairing. She had been issued with this disciplinary notice. She had 4 young children. She was leaving her 12-year-old in charge of the other 3, and she felt really uncomfortable. So obviously that's our role as a trade union to represent her, and we did that. But there was no plan, there was no government policy. So in the future, I think the fact that the majority of nurses and midwives who work on the front line are women is not a secret. It's well known. Globally, it's well known. It is a female-dominated profession. So in a pandemic where they become the absolute essential workers, the whole focus on childcare for them should have been much, much better, is our view. I suppose the second issue we had a lot of disquiet and disharmony about was our student nurses. Student nurses in Ireland do 13 weeks on ward-based duties to learn. They're unpaid during that period, and many of them were not rostered off duty. So they were advised that unlike other students, unlike universities that were closed, they had to attend. Now, they were being used effectively as a workforce. They were very young. They had never been on wards. The first years, for example, had never been on a hospital ward prior to that. Second, third years, fourth years. So you had a workforce there that were unpaid in the case of first, second and third years, very young, dealing a lot with death, and death in a circumstance which wouldn't be normal even for nurses with many years of experience, because people were dying on their own. They were dying in terribly frightening conditions, and their families were not with them. And you had very young students who were not qualified dealing with this. So we had a lot of lobbying of government. We sought to have the students removed. We said it was not a learning environment. And we also thought that when they were on duty that they could assist, but they would have to be paid. We were successful for about 6 months in getting them a healthcare assistant rate of pay if they were on duty, but not looking after groups of patients, but assisting and carrying out the role of a healthcare assistant. But that was a huge battle. I think if we look back, we really and truly did a disservice to the learners, and they were used as unpaid, they were exploited. I used that term publicly, and I was chastised by our political leaders and also our HSE, which is our health service executive. But that is exactly what happened. They were exploited. Many of them will find it difficult to complete their training, is my view. And it is a very difficult thing to do to nurse people who are very scared themselves, because at that point, you know, early on in the pandemic, there was a lot of unknowns about transmission and a lot of unknowns about etiology. In other words, would people recover, or was it inevitable that they would die? So there was a huge, huge burden placed upon trainees, and I think it is something that we must do better into the future. And I think then finally, just on this topic, I think the big issue for us now is that we have a lot of nurses who were infected at that time who have long COVID. They haven't recovered, and there is no scheme in place for their protection going forward. So in other words, if they're in the public sector, they will have sick leave pay for a period of 6 months. If they're in the private sector, they don't. And many of the nurses have a lot of additional bills, such as consultant fees for respiratory, for physio, for basic recovery. And there's a lot of unknowns about long COVID, and they're not sure if they will be returning to work. We have lodged a claim on our government, which seeks to have COVID-19 classified as an occupational injury. And we believe that this should be the standard. We believe from our connection with our European Federation of Nursing colleagues that about 17 EU states have classified COVID-19 as an occupational injury for healthcare workers, following on from the Biological Hazards Directive, but Ireland has not. And we believe that if this was a male-dominated profession, that would be different. That's, I suppose, one of the issues that we continue to pursue. And finally, we surveyed our members in respect of burnout, and I think burnout has always been a feature of a high-intense job, such as the caring professions. However, during the COVID, and even now, we have a lot of absences, so your numbers and your roster might look okay, but actually those that are at work are far lower. So pregnant workers, for example, were not protected, so they were not rostered on. And we were in full agreement with that, because we didn't know what effects COVID-19 would have for pregnant women. Likewise, we have a high dependency on non-EU nurses, particularly those from India and the Philippines. And there were a lot of worrying statistics about the negative effects for the BAM community. So again, for the highly exposed areas, COVID wards, intensive care units, we had lower rosters, because these workers, in order to protect them, could not be rostered in those locations. So that has a legacy where we now still have very poor rosters. We have a lot of sick leave, and the incidences of burnout are quite high. And our surveys, which we completed over April and July of our members, indicate, unfortunately, that 68% of those we surveyed believe that they will leave not just leave their job, but leave the profession. And that is, unfortunately, I think the legacy that this pandemic will have. So I don't know if I've covered everything there, but I think there's much more I can say. So I'm happy to take any questions.
I'm sure there is much more to say, but just to reiterate that again, the description of the situation you just gave is entirely in line also with the findings of the European Working Conditions Survey for healthcare sectors for workers in the healthcare sector for 2021, with very high levels of work intensity, very high levels of emotional demands. You were describing that quite well. Poor work-life balance, and at the same time, even though the feeling that work was well done, that we're doing useful work, nonetheless a feeling of not being recognized sufficiently for the work that is being done. We see that in the survey as well. And this move out of the sector, that's also something that Martina just described. We will get back to you, all three members of this first panel, at the end of our session for your number one takeaway. You may already want to think about that. But right now, I want to move to the second panel, because at the same time, in parallel of this Gender Equality Forum 2022, there is another very important event taking place in Prague, which is the high-level conference on tackling energy poverty, the EU approach and sharing best practices. And that is a conference called by the Czech presidency of the Council of the EU. And two colleagues of ours are joining us now, hopefully from Prague, if the technology works, to share with us what has been discussed at this presidency conference about this new crisis that we are facing, a cost of living crisis, energy poverty crisis, and again, how to react and to avoid gender differences in suffering from the impact of these crises. Do we have with us, hopefully now, Blondine Mollard from the European Institute for Gender Equality and my colleague Massimiliano Mascherini, Head of Social Policies in Eurofound. Blondine and Massi, can you hear us?
I don't think they're there yet.
They're not yet there. Okay. In that case, why don't we go back to our first panel and explore a little bit more, and maybe Phil, I start with you. If we look at the situation of nurses, midwives, healthcare workers more generally, for you, where does the focus have to be in improving working conditions, in improving, I assume, also pay in this sector in order to ensure that we will have the workforce that we need for future crises, but also in face of demographic changes that will make the provision of healthcare, the provision of care, even more important in the EU. Phil, can you share with us where you see the focus needs to be?
I think first and foremost, pay obviously has to be reviewed. Very definitely, the job that nurses and midwives do today is entirely different to the job, for example, that I would have trained in almost 30 years ago. Much more autonomy, a lot more decisions have to be made, very high skills required, and also very demanding, because obviously, thankfully, our populations are living longer and we're becoming more innovative with our medicine. So therefore, the skill set that we require from our nurses and midwives need to match that, and it does. But the pay doesn't keep pace. Secondly, I think the staffing levels, we have to have legal limits of staffing, so that, for example, if you have a bus and you have X number of patients or people on a bus, and you have a driver, you have a limit on how many hours he can drive or she drive. You have a limit on how many patients can get on the bus. In healthcare, none of these protections exist. So today we have 630 people in Ireland, in the Republic of Ireland, on trolleys. So they're in hospital, they're sick enough to be in hospital, but there's no beds. And that's not just a feature of our country. So there's no limit on the numbers who attend public hospitals for care, but there is no statistic that says, and there is no law that says, in order to provide care, one nurse can only safely look after, for example, 4 patients or 6 patients, depending on the circumstance. So many occasions we will have nurses. For example, we had one occasion last week where 7 nurses were in a unit with 100 patients and 50 admitted patients. So that's 150. It's just impossible. So we must have ratios, we must have legal underpinning of ratios, and then we have some chance of getting a safe workplace. So we need health and safety legislation to look at our workplaces and what is not safe, just like we do in the male-dominated professions such as construction and manufacturing. We don't have that in healthcare, and we must have it. So I think there's 3 of the main points that I would think are really important.
Thank you so much, Phil. Very, very precise and concrete suggestions of what needs to change and what needs to be done. I'm being told that we now have our connection to Prague. Blandine Mollard, researcher at the European Institute for Gender Equality, and Massimiliano Mascherini, the head of the Social Policies Unit in Eurofound. Massi, hello. So good to see both of you, Massi and Blandine. Excellent. Massi, can I start with you? Can you fill us in on the question, what impact, what do we know already about the impact of the energy poverty crisis and more generally the cost of living crisis? What is the socio-economic impact based on Eurofound surveys and research that we've already done?
Thanks a lot, Barbara, and good afternoon from Prague, actually. Here in Prague, we are discussing the energy poverty and the gender aspect of the energy poverty. The crisis that started with the invasion of Russia, of the Ukraine, actually, has boosted and the cost of living in Europe with the rising cost and rising inflation all over the continent. The cost of energy has increased incredibly, and in a framework of weaponization of energy following the conflict. The increased cost of living is unevenly distributed between men and women, with women that are suffering more the increase of the cost of living as well as the increase of the price of energy. And these actually open rooms for the problem of energy poverty, which is felt more by women than by men. There are several reasons for this. One is the more unstable labor market participation of women to the labor market. The other one is the problem that we all know, that is the gender pay gap, as well as the use of energy that we do in our household, and these raise particular issues to single mothers. This has been the core of the discussion here in Prague regarding the different shares of women and men at risk of energy poverty. We have more than 30% of women against the 26% of men, according to our recent publication. We discussed also policies, but this is more or less the core of the discussion.
Thank you, Massi. And then maybe, Blandine, first question to you. Were there already discussions about the policy responses? It's also, if I understand correctly, the conference about good practice examples. Have member states come up with solutions to this problem and the unequal impact on men and women of the energy poverty crisis?
Oh, yes. We've discussed really a lot of the ways by which this crisis of energy might actually affect some of the gains that we made very painfully and slowly on gender equality, We discussed how energy prices or energy poverty is increasing women's unpaid care burden. It might affect also the incidence of intimate partner violence. It might, of course, affect health. We also mentioned several aspects that might be less known in terms of energy poverty. For example, that it's not only about the winter, it's also very much an issue when it comes to cooling. We know that older women are more vulnerable to mortality in heat waves, for example. But yes, in terms of solution, there has been also a lot of proposals. For example, we discussed the Climate Social Fund that is being discussed at the moment and how it can have the proper mechanisms to identify and address the needs of the most vulnerable in terms of income support or a direct cash transfer. We also discussed the need for improving the representation of women in the sector. At the moment, only 23% of women work in the energy sector, and that, of course, affects the governance and the likelihood of gender-responsive initiative to be brought forward. There were also a lot of very promising initiatives that were discussed. We heard about small-scale projects to empower low-income women to produce electricity through solar panels and how to replicate those successes in different member states. We also heard on the effects of increasing energy literacy in the part of vulnerable consumers and how that can really increase well-being and diminish also energy consumption. So yes, we've heard a lot of things. Unfortunately, there is still a lack in terms of gender mainstreaming in the energy policies and climate mitigation policies. So this is something that needs more effort. But there was indeed a lot of good examples, and clearly, as Massimiliano said, we see the political will to really address energy poverty. That is really at the center of the political debate at the moment.
I see. Maybe as a final question to both of you, was there a sense of more of the same? We are seeing the problems that we encountered before in terms of gender inequalities across so many areas of life, or is there actually something new in this situation that we are now facing and therefore new solutions?
Well, I think that in terms of energy poverty, there were a stronger consensus of the need of having a clear definition that is shared across Europe in order to measure this concept, because only when it's measured, then we can understand better who is the population more at risk. So there is a strong consensus, as well as the consensus that women are the population more at risk of energy poverty. And then another thing that was a bit new still in terms of policy discussion was that we are following on the news actually the various meetings of the member states, but there is here around in the room a consensus over the need of some European coordination for this crisis in order actually to do like in the COVID, when we were one front that were moving together, trying to find a shared solution in order to avoid that this crisis will result in divergence among member states and disparities among member states with an asymmetric impact of the crisis. So to quote our Director General, actually, we need a united Europe, because if Mr. Putin wants us divided, we need to react together as we did for COVID-19.
Thank you, Massi. Blondine, anything to add?
Yeah, so I agree. I mean, energy poverty is clearly not a new phenomenon. It's been on the radar for several decades. Unfortunately, at the moment, the situation has become extremely acute due to many reasons, especially the soaring prices in energy. So this is a topic that has become really forefront. So with this urgency, there are also some innovative proposals, including a wild ban on disconnections to make sure that a vulnerable household will not lose access to power, to heating, and with the disastrous consequences that could come with it. So yes, it's not a new topic, but the situation is such that it calls for a really innovative and coordinated solution very urgently.
Fantastic, thank you so much. It was great to hear from the horse's mouth so directly from this important conference taking place in Prague today. Thanks very much, Blondine and Massimiliano.
Thank you for having us.
Anytime. We are now coming to the last input in our session, and I would like to welcome Professor Rosie Campbell. Rosie is Professor for Politics and the Director of the Global Institute for Women's Leadership at King's College. She has recently written on barriers to participation in politics, gendered patterns of support for the populist radical right, and what voters want from their elected representatives. Rosie, having listened to the discussion on the gendered impact of disruptions, the different disruptions that we looked at, what needs to happen to prevent these differential impacts on men and women? Is participation the key?
I found this absolutely fascinating. I've learned a lot. You probably noticed I've been scribbling hundreds of notes. I wish I could just give you the solution. I think if it were that simple, perhaps we might have addressed this sooner. But I think that the antecedents of the solution are in the conversation today. And I think I'm very struck by how important the data is and how that the disaggregation of this data is absolutely key. And I think one of the things that I have underlined over and over again is this issue about the lower paid women in what Martina describes as the client-facing service workers, the lowest paid women being the ones that actually have been the slowest to recover from the actual COVID crisis. And of course, they are now at the forefront of experiencing the impact of the cost of living crisis. And so we know that these underlying structural gender inequalities combine, but actually when we start to see that chain and see the statistics, you can see that the scale of the impact. I'm looking at some of the statistics around who's most concerned about their ability to pay their bills. You can see from some of your Eurofound research that 44% of single mothers are concerned they're not going to be able to pay their utility bills this winter, compared to 30% of couples with children. Whereas there's about a 5 percentage point difference between single men and women, with single women slightly more worried. But the real difference there that was also mentioned by Maximilian was this issue around single mothers, and particularly how vulnerable many single mothers are. And I think the solution is both this kind of rich, in-depth analysis, this quantitative analysis, combined with the incredibly helpful qualitative insights that both Anna and Phil shared. I mean, Anna, I thought, some of the stories that you recounted, of in particular women's experiences during the crisis, were just so horrific, and yet spoke so much about how we continue to devalue care, both paid and unpaid care. And yet, Anna, I think you gave very striking examples of how actually a strong welfare state and a culture that champions the division of labour between men and women that's more equal can provide resilience and protection in case of shocks. And so I feel that everybody in this conversation is well aware that for the current shocks, economic shock we're facing, and for future economic shocks, actually the resilience we need is by creating a more equal society, and that requires good, affordable childcare of high quality. It requires policies that encourage men and women to share childcare responsibilities when that's appropriate, by using, for example, the Swedish model of use it or lose it leaves. It involves moving away from cultures that valorize overwork and actually don't involve taking good care of our physical, mental health or our work-life balance. And it involves thinking about those of us who are privileged enough to be able to work from home some of the time, drawing boundaries. And all of us in this room, I think, are able to see these problems quite clearly as a result of this conversation and the other conversations we've been having. And yet there's a huge disconnect between that and actually how many policymakers or decision makers deal with these issues and how they see these problems. Because clearly in the COVID crisis, core child care and the gendered nature of care was not fully understood by policymakers. And I think one legacy of that crisis should be the understanding that care, childcare, healthcare, social care as core infrastructure for a modern society and not something that you can cut when times get tough. And yet my concern is that I am not sure that's the political rhetoric that we're seeing in response to this cost of living crisis. Actually, a lot of the attention is moving on to, certainly in the UK where I'm based, into cuts rather than supporting welfare and public services. And one of the things I was tasked with was to try and think politically, how do we bring this knowledge and insight into real change? And of course, many of you have pointed out that there's variation across the European Union and that there are countries who are doing better on this. But I think one of the things I was struck by reading the Eurofound research is that actually a huge number of the interventions around the current cost of living crisis are not targeted. They're very generalised to the whole population or nearly the whole population. And yet we've seen how pockets of the population, particularly women, particularly single mothers, particularly women in low-paid work, are those who need this targeted support. The message isn't getting through. And I think politically, one of the issues is that we have seen increased representation of women in many countries, but we are not necessarily seeing increased representation of women and men who've had the kind of life experience where they are likely to have their gas and electricity turned off. And we need more people with that direct experience in our politics. And I think I don't have the answer to how we get to that, but that's an absolutely key factor that we know from the research that having women in the room changes the nature of the political conversation. Issues such as violence against women and girls were not considered to be political issues, neither was childcare until we had more women politicians. And I think we need a more diverse group of politicians. But without having that, I think that what we're doing here is key, and then it's making the point that economic resilience requires a more equal society and trying to fight the narrative that actually what we need is a race to the bottom, actually to cut our healthcare services, to cut our infrastructure that supports people into paid employment. Because if we do that, actually we're undermining our economy. I wish I had more answers for you, but I do feel that this conversation, this data analysis is a positive step in the right direction. And I think there are so many solutions there are so many possible solutions that I've scribbled down, and they all add together incrementally in a way that could really make a difference. But they'll only make a difference if that broader narrative is one that actually is well understood by decision makers. And that is that actually the reason that some countries were more badly hit by the COVID-19 pandemic than others was this underlying structural inequality, which is to a large extent gendered. And as we face the oncoming onslaught of the impacts of the Russian invasion of Ukraine, those gendered impacts are so clear to see, and yet they're not at the forefront of all decision makers. And that's what we need to do to try and deliver a more prosperous future for everybody.
Fantastic. Thank you so much, Rosie. I like this line, economic resilience requires more equal societies. I think that's already a great takeaway. I will ask the members of the first panel for their takeaways in a moment, but we still have a little bit of time. So I'm looking around in the room. I'm also looking at my colleague Christina, who keeps an eye on questions that might be coming in from the online audience. But is there anybody in the room who would like to ask a question to one of our panels? Yes, please, go ahead.
Hi, thank you so much. My name is Hannah Manza. I'm from the Violence and Society Centre in London, and we specialise in gendered violence. And my question was basically around which women. Are we talking about migrant women, low-income women? And I think this was raised by several of the speakers, but particularly thinking about the backlash against migrants and ethnic minority groups during austerity following the global financial crisis. What are your kind of concerns around a backlash of discrimination against these groups in the wake of the cost of living crisis, in the wake of the pandemic? We've already seen discrimination against people of Chinese or East Asian backgrounds during the pandemic. And what are your kind of concerns in how this will filter through into issues of labour market exclusion and discrimination in the workplace? Thank you.
Thank you for that. We'll take the other question, which gives, back there, please. Our panelists also a bit of time to think about possible replies. Please go ahead.
Yes, thank you very much. I'm Marine Ulrich from the European Disability Forum. So it's actually kind of a follow-up question to ask whether you have any remark in relation to gender equality and women with disabilities. So for example, in employment, we've seen that the digitalization of work can provide a lot of opportunities, but also sometimes there are like challenges for women with disability as well. Also in relation to the cost of living, we see also additional issue, for example, for women using assistive devices, who will spend more energy also for the mobility devices and so on. So if the speakers have some remark about that, that would be great. Thank you.
Thank you so much for these questions. Unfortunately, our two energy poverty specialists, Blondine and Massimiliano, are no longer part of the panel. They had to leave for the airport in Prague, but I'm sure that Martina, Anna, and Phil might have some answers to your questions nonetheless. Please, Martina, maybe, do you want to give it a first shot?
I mean, these are two extremely important points, and very different in their nature, but also related because we're talking about intersectional inequalities, which is something that has been mentioned already several times in the other session during this forum, and it's a key aspect to take into account. You know, for the time constraint, also we didn't have the chance to develop this, but you know, regarding migrant women, there's no doubt that they carry a double burden in terms of employment opportunity, but also when we look at really which jobs they take up, they are usually like pushed into kind of lower skilled jobs, even if their educational attainment is actually higher. So there's clearly also a mismatch there. So it's certainly a category that would deserve very much attention, because then the jobs that they usually take up are also at the lower end of the wage distribution. So again, we related to all the points that have been made before. So yes, it's a very valuable point, and I think now, I mean, in the context of the Ukrainian crisis and all the wave of refugees who are mostly women with children, and of course, there has been, with the Temporary Protection Directive, a way to facilitate their integration in Europe, but still, there are additional obstacles which we shouldn't forget. So it's definitely a call for action for policymakers and researchers as well to look more specifically at this group. Regarding women with disabilities, I mean, Eurofound has conducted a lot of work on the inclusion of people in general, men and women with disabilities. I'm sure that perhaps in the chat our colleague could send some links to our reports, and then we can follow up also with you. But again, in the general context of the issue of addressing intersectional inequalities, that's certainly another clearly vulnerable group in the society that we should carefully take care of. So thank you for raising the point.
Thank you, Martina. Anna, I could imagine in a big company like Microsoft, you have experience and also maybe solutions, please.
Yeah, specifically on the digitalization part there for people with disabilities, something we have been working on for many years to build into the technology, because technology for people without a disability makes things easier, and for people with a disability can make things possible. that they couldn't do before. So for example, if you have certain skills and you suddenly don't have to go to the job every day, because it's hard work when you're in a wheelchair until you get there, you know, you need much longer than maybe someone who doesn't have this disability, but can work from home. They save so much more time and can still get engaged much more. But even more fascinating is things like people with disability in hearing and seeing, because technology now can actually, I've seen people, I've been on calls, video calls with people who are blind, and also with hearing disabilities. And the technology does speech to text, text to speech, and gives them the possibility to be fully included. Whereas if you're sitting in a room, that might not be as easy. So it's fascinating to see how we can help to include more people. On the other part there, apart from, I know that we did quite a few activities, because many women who then work from home or were locked up at home if they didn't work, had quite a few issues, because it's harder if you have violence at home. And building a bit on what Rosie said as well, you know, it says you have no one to talk to, you can't go out, so no one, you know, we saw and heard about violence rising, so we did quite a lot of charity, but also internal awareness about these things. And for example, established a hotline for we are almost 300,000 women at Microsoft. So just statistically, it's just probable that quite a few would suffer at home for violence from the partner or similar things. So it's up to every company who learned there that we have to provide new channels for them to get in touch, so that we as a company can help. It's very sad to hear, but there are things that you can do there.
Thank you, Anna. Phil, please.
Thank you. I suppose just to add to Anna's points, in respect of disabilities, and you know, being able to work being possible and being much easier because of infrastructure such as IT, I think that governments must be reminded that this isn't a luxury, that this is an essential. So if somebody, for example, is on dialysis, the energy cost of that is going to be higher, but it's going to be essential to maintain your life. So therefore, in order to work, I think that the human right of being able to work must be categorized in the same way. So if that requires additional costs associated with energy, well then they must be covered by the state, would be, I think, my strong view. I think in respect of the disability legislation and all of the good work that we have over recent years developed in that area, we must make it real for those with a disability, and not just a facility to argue your case when you have been discriminated against. We need the legislation to have a more positive effect in that we preempt and we make life easier. And I think that's my points in respect of that. In respect of the migrant workers, yes, I think, again, equality legislation is very important. I think what we must realise is the WHO are very clear that we cannot be relying on countries that themselves are short of essential workers to prop up for example, our health services. And we have a huge reliance in Europe on migrant healthcare workers, both doctors and nurses, from non-EU countries. They do have the right to work. They come on critical skills visas, but they don't have the right to bring their families. And sometimes they can get visas for their families to live, but not to work. So, you know, if we're relying and we're asking people to come to assist us in delivering our essential services, the very least they should have is the right to make a new life if they so wish, but to live with their families. We have a high number now of women working in Europe who are leaving their children in their parent country to be raised by grandparents. And that is, I think, going backwards. And all of us who are interested in the rights of women workers must try to do more to ensure that family reunification is part and parcel of European policy when migrant workers are asked and given critical skills visas to work in Europe.
Thank you, Phil. We only have 3 minutes left. I warned you I would ask for a takeaway. So, looking to the future, can you give me your number one takeaway for reducing gender inequalities across the board? That was what Commissioner Dalli this morning called for. Martina.
Yeah, challenging. Well, we can think in a way of gender equality really as a continuum, and on one extreme, if we have strong gender inequalities in our society and economy, when a crisis hits, we have a strong gender unbalanced effect, and we need gender policy responses to address that. So really going at the root of those gender inequalities, which then are usually amplified with crisis, is essential. And I think that there's lots of different layers that we need to work on together, but we also need to start from the bottom. And for me, fighting gender stereotypes also at an early age, it's really a fundamental step to begin with, one of the many things.
It is a challenge, I have to admit. Thank you very much for that. Anna, your number one takeaway.
The takeaway is being on this meeting today and talking with you guys, because you're seeing, even if we're talking about different industries and different works, essentials, non-essential, and hearing Phil speak, my sister is a nurse. I've had this for the last 2 years and seen it firsthand with all the challenges. But I liked something, sorry that Massimo's not here, but he said one thing that I'm going to paraphrase and pull out. If we drive awareness around these topics like we are today and talking and have a joint response across all European countries, I think that's one of the key things that need to happen, because we're still disconnected and there's a lot of things like tax laws and work constitution acts that are keeping us from this. So the more we discuss and share like this, the more we can drive that forward.
Thank you, Anna. Phil, please.
I think we have to bring a closer awareness on gender proofing all agreements at policy level. And I think that, I have been in rooms negotiating particular agreements where the gender issue is, not a deal breaker would be the phrase used. I think it has to become a deal breaker. If agreements are not conscious of the effects on gender, on those with disabilities, I think we have to make sure that we make it a deal breaker.
Thank you. Thank you to all our speakers, Professor Rosie Campbell, Phil Nihey, Anna Kopp, Martina Bisello, Blondine Moulin, and Massi Mascherini. Thank you to the technical support team for this session, and of course to you, our audience here, and the audience online. I hope you found it worth visiting and joining this session. Stay tuned, there's more to come, and if you want more information on the data, the evidence that we presented, please go to the EIGE website and the Eurofound website for more. Thank you very much, and goodbye.
Thank you.